Hello everyone, good evening to all of you. Welcome back to the GDC English classes. How are you guys? Good evening to all of you. Good evening, Filter, Himanshu. Good evening. Good evening, Ishu. How are you all? How is it going? Hmm, quite a cozy weather, no? All around India. Cozy weather, cozy weather. Okay. Yes. पेनिसिलिन सर आपका कितना आया आरआरबी में? पेनिसिलिन पहले नाम बताओ. किसकी आईडी बनी है तुम्हारी? रियल नेम से आओ पहले पेनिसिलिन. तब हम बताएंगे कितना मार्क्स आया. How's it going, guys? How's the preparation going on for the NIPER? Yes. How's it going on? How are you all? Hana, how's the weather over there? ठंडा हो गया मौसम अब. Filtered? Good evening, Shravani. How are you? I'm good. Thanks for asking. Yes, बच्चा लोग, how are you all? ठीक ठाक? Okay, fine. मैं वही इंसुलिन हूँ जिसने नाम बदल के पेनिसिलिन रख दिया है उस दोपहर वाला. ओके, इंसुलिन. क्या बात है. तुम्हारे कितने आए? इंसुलिन या पेनिसिलिन? पहले नाम बताओ. भूल गए थे. द वेदर इज कोल्ड. यस, इट्स कोल्ड ओवर हियर आल्सो. हाउ इज इट गोइंग, गाइस? हाउ इज इट गोइंग? चलो, so we do have today pharmacology, drugs acting on the central nervous system. थोड़ा सा ब्राइटनेस कम करी जाए. ऐसे इतना ठीक है, आई थिंक, है ना? ओके. So, tell me, how's it going? How are you guys? I am asking from a last 10 minutes maybe. Not 10 minutes, but yeah, 3 to 4 minutes. Fine. Everything is good, sir? Okay, fine. मेरा खेल खत्म है सर. ज्यादा नहीं आया. नॉन फार्मा पे चढ़ गया. फार्मा में 61 आया है. अच्छा ठीक है. कौन सा जोन था तुम्हारा? कौन सा जोन था तुम्हारा? पेनिसिलिन. विच जोन यू फिल्टर्ड? और दोनों मिला के 64.3 चांस है क्या जनरल में? जोन बताओ पहले. पेनिसिलिन पे जोन बताओ. ऑलराइट, सो वी डू हैव ड्रग्स एक्टिंग ऑन टू द सेंट्रल नर्वस सिस्टम. दिमागी हालत पे जो दर्द दवाएं काम करती हैं. द ड्रग्स एक्टिंग ऑन टू द मेंटल स्टेट, राइट? एंजाइटी, डिप्रेशन, साइकोसिस, पार्किंसनिज्म, अल्जाइमर्स, बाइपोलर डिसऑर्डर. लास्ट ईयर अहमदाबाद की कट ऑफ कितनी थी? एनालाइज किया? लास्ट ईयर की कट ऑफ अहमदाबाद की कितनी थी? 64.3. दैट्स अ ठीक ठाक स्कोर. चांस है, बॉर्डर लाइन पे हो. ओके, चलो गाइस. एंटी साइकोटिक और जीपैट 2026 का प्यार. यस. चलो, here is the first question for you. Here's the one. So entacapone and tolcapone are which type of the enzyme inhibitors? Entacapone and tolcapone are which type of enzyme inhibitors? MAO-B inhibitors, COMT inhibitors, acetylcholinesterase inhibitors, or dopa decarboxylase inhibitor? Which one is it? Which one is it, guys? So here's the first question for you. Entacapone and tolcapone are which type of the enzyme inhibitors? MAO-B inhibitors, COMT inhibitors, acetylcholinesterase inhibitor, or dopa decarboxylase inhibitors? That is obviously going to be your COMT inhibitors, right? Catechol O methyl transferase inhibitor, to be precise, right? They act both side, centrally as well as peripherally, right? They metabolize the dopamine. So out of these two drugs, there is a one question they do ask, like, which of the following drug acts in both way, centrally as well as peripherally? Which one is it? Filter says entacapone is peripheral. Entacapone is both peripheral and central. Around 70 था लास्ट ईयर. मेरा बॉर्डर लाइन पे है. देखते हैं तुम्हारा कौन सा शिफ्ट था. सेकंड शिफ्ट था, थर्ड शिफ्ट था पेनिसिलिन? यस. Which one is it? I think so. Tolcapone. which I have read, that is your 𝘿𝙀𝘀. 𝘿𝙀𝘀 acts centrally as well as peripherally. What do you think about this one? Hmm. 𝘿𝙀𝘀 or 𝘿𝑎𝑃one? 𝘿𝙀𝘀 है, I think so, मेरे ख्याल से. Hmm? Which one is it? That's your 𝘿𝙀𝘀, right? I have learned this one. Two means two. Two means two, right? Two sides, peripheral as well as central. That's why 𝘿𝙀𝘀 acts onto the both sides, centrally side as well as the peripheral side. Just look onto this word. TO means two. Two means two sides, right? Peripherally as well as the centrally. Understand? Now, MAO-B inhibitors. MAO-B inhibitors. Can you name MAO-B inhibitors? Which are MAO-B inhibitors? These are the resergelin, as well as the selegelin, right? Selegelin, right? Acetylcholinesterase inhibitor. These are your what? These are your what? Indirect acting. Indirect acting. Indirect acting. टोल का पोन में ही हाइपरटॉक्सिसिटी होती है, इसलिए प्रेफर नहीं किया जाता है. दैट्स राइट, दैट्स राइट, दैट्स राइट. एसिटिलकोलिनेरेज इज योर इनडायरेक्ट एक्टिंग कोलिनर्जिक ड्रग, राइट? इनडायरेक्ट एक्टिंग कोलिनर्जिक ड्रग. सिंपल, right? Dopa decarboxylase, carbidopa, carbidopa. Yes, carbidopa is your dopa decarboxylase inhibitor, है ना? And carbidopa plus levodopa is going to be having on and off phenomena, if you remember, right? On and off phenomena. DZR for your information, ये हिंदी चैनल नहीं है, ये इंग्लिश चैनल है, इसलिए हम अंग्रेजी ही बोलेंगे. ठीक है? So sorry for that. बीच बीच में I can do some Hindi, but I do prefer English only over here. Okay, मेरा third shift था. Same. Penicillin. Okay, there is a ratio, don't worry. Sorry, there is a possibility, penicillin or insulin, जो भी तुम्हारा नाम है ना? हो सकता है, ठीक है? Don't worry about that one. चलो. Okay, alright guys. Selegelin, resergelin, moclobemide, no, Bosnavar. Moclobemide is your MAO-A. MAO-A is your moclobemide. Moclobemide, right? Moclobemide as well as your chlorgyline, right? Chlorgyline. Understood? MAO-A inhibitors. And MAO-A inhibitors are useful in your depression, anxiety. MAO-B, Parkinsonism. Okay? Chalo, fine. Now, high affinity of morphine. आपने marks नहीं बताया सर, क्या करोगे जान के यार? Okay, high affinity of morphine. Which opioid receptors? Mu receptors, kappa receptors, delta receptors, and mu and kappa receptor. Which one is it? Chalo, simple. Sir. Yeah, that is going to be simple. High affinity for morphine is going to be your A receptor, right? Mu receptor, that's right. Very good, very good, very good. So this is the classification you have to remember, and that's an important one, okay? Chalo. Neuroleptics are used to treat. Neuroleptic are used to treat neurosis, psychosis, narcolepsy, or Parkinsonian. Which one is it? Neuroleptics. I'm asking neuroleptics. हाँ, तुमसे थोड़े से ज्यादा है इंसुलिन. थोड़े से ज्यादा है, ज्यादा नहीं है. तुम्हारे 64.3 है ना जनरल, बस थोड़े से ही ज्यादा है. एक नंबर ज्यादा है तुमसे. चलो ठीक है ना, एक नंबर ज्यादा है, 65 है. इलाहाबाद रीजन था. ओके, चलो. न्यूरोलेप्टिक्स आर यूज्ड टू ट्रीट, दैट्स योर साइकोसिस, राइट? सिंपल. हाँ. पार्किंसनियन डिसऑर्डर नहीं है बॉसनावार. नो फिल्टर्ड, नो. It's going to be psychosis. Neuroleptics are known to be your D2 blockers, right? D2 blockers. And D2 blockers are what? Used in psychosis, obviously. But D2 blocker can cause Parkinsonism. Can cause Parkinsonism. Through which syndrome? Parkinsonism. Through which syndrome? That's your EPS, extrapyramidal syndrome, right? And which drug causes the maximum? Which drug causes the maximum EPS? That's your haloperidol. Haloperidol, right? There are neuroleptics and they are known to be as the analeptic as well. Which drug are known to be as the analeptics, guys? Yeah? Can anyone tell me? Can anyone tell me which drugs are known to be as analeptics? पेनिसिलिन नंबर सुन के भूत चढ़ गया क्या तुम्हें? अब तुम्हारा रिप्लाई नहीं आ रहा. चलो कोई बात नहीं, एक ही नंबर ज्यादा था मेरा तुमसे, ठीक है? चलो, analeptics, that's your what? Respiratory stimulant, right? Respiratory stimulant. Respiratory stimulant. And the drug known to be as your doxapram, if you remember. Doxapram, right? Doxapram. And there is another one known to be as similar. That's your anorectics, right? That's your what? Anorectics. Anorectics are the ones which are what? Anorectics are what? Anorectics are the one drug which decreases the gastric appetite, right? Which decreases the gastric appetite. That is your anorectic drugs, right? Simple. Chal. Now, buprenorphine. Next question, guys. Next question. Buprenorphine, partial mu opioid receptor agonist, mu receptor agonist, copper opioid antagonist, delta opioid agonist. Which one is it? Yeah. Buprenorphine. Buprenorphine, simple, partial mu agonist, mu opioid receptor agonist, right? Simple. Chalo. Only 6 students left. Fine. No worries. Dianeptal. नई चीज पता चली. क्या नई चीज पता चली? Filtered. Now, tianeptine act by inhibiting 5-HT reuptake, inhibiting noradrenaline and dopamine reuptake, alpha 2 blocking or enhance the 5-HT reuptake. Which one is it? Yeah? Now 5 students left. धीरे धीरे सब चले जाओ यार. I don't care. चलो. Tianeptine acts by inhibiting 5-HT reuptake, inhibiting noradrenaline dopamine reuptake, alpha 2 blocking, enhancing 5-HT reuptake. That is what? Simple. That's so enhancing 5-HT reuptake, right? They enhance the uptake. Okay, atypical antidepressant. That is what? Atypical antidepressant increases the serotonin uptake in the brain, right? Reduces the stress-induced atrophy or neuronal dendrites. Okay. Now indicate the anesthetic which is used intravenously. Simple. Simple. Indicate the anesthetic which is used intravenously. That's your propofol, halothane, desflurane, or nitrous oxide. Which one is it? Which one is it, guys? Okay, एनालिप्टिक वाला नहीं पता था. Okay, fine. मतलब हिंदी वाला चैनल शुरू हो गया इसका मतलब, राइट? इसी वजह से सारे लोग वहाँ चले गए. फाइन. चलो, indicate the anesthetic which is used intravenously. That is what? That is your propofol, right? And propofol can be used in asthma, can be used in asthmatic patient, right? Can be used in asthmatic patient. Wow. Now only one left. Now, and can also be used in children, right? Can also be used in children. Chalo. Fine. Indicate the drug that induces the Parkinsonism syndrome. Chlorpromazine, diazepam, triazolam, or carbamazepine, guys. Which one is it? Yeah? Preferred in asthmatic. That's right. Yeshubaniwal. Hana? Indicate the drug that induces the Parkinsonian syndrome. Chlorpromazine, diazepam, triazolam, carbamazepine. Which one is it? Parkinsonian syndrome. That is what? That is what? EPS, right? Extrapyramidal syndrome. So out of these, which one is neuroleptic? Phenol to theek, but what about others? Chlorpromazine, diazepam, triazolam, or carbamazepine? Anyone? That's what? Fine. Don't worry about this one. Yeah, that's correct issue. है ना? Chlorpromazine is going to be your correct answer, right? Chlorpromazine is going to be your correct answer. Diazepam, triazolam, these are your what? Benzodiazepines. Carbamazepine, anti-phyretic drug. Diethyl carbamazepine, DEC, right? DEC, diethyl carbamazepine. Simple. Chalo. Which of the following is a dissociative anesthetic agent? Simple, and plenty of times they have asked. Dissociative anesthetic agents. Anyone? Yeah? Dissociative anesthetic agent. Aminostilbene. क्या aminostilbene? Dissociative anesthetic, that bacha knows. Ketamine, right? Ketamine is a dissociative anesthetic, which is your NMDA antagonist to be precise, right? NMDA antagonist to be precise, right? They decreases the glutamate levels, correct? Thiopentol is your ultra short acting drug, correct? Chalo. Drug with both antidepressant and antipsychotic properties is, okay, buspirone, amoxapine, trazodone, or meancerin. Which one is it? Buspirone is your 5-HT1 partial agonist. If you remember, partial agonist, right? Partial. It increases IOT. क्या नहीं समझा? Intraocular tension. Okay, yeah, intraocular tension. Amoxapine. Yeah, amoxapine is going to be the right answer. Amoxapine is your atypical antipsychotic, right? Atypical antipsychotic, and it has also been used. It has also been used in your antidepressant, right? Trazodone, meancerin. Meancerin is your alpha 2 agonist, right? Alpha 2 agonist. Meancerin. I don't know. Kya I don't know. Diazepam is used as Diazepam is used as major tranquilizer, minor tranquilizer, medium tranquilizer. Anyone? Tranquilizer what? Which causes sedation? Hypnosis to be precise. Hypnosis to be precise. That is what? Minor tranquilizer. Okay? Chalo. Opioid analgesics used in the obstetric labor. Okay. Obstetric labor में कौन सी opioid analgesics को use कर सकते हैं? That is your fentanyl, pentazocine, meperidine or buprenorphine. Which one can be used? Which one can be used in obstetric labor? Fentanyl, pentazocine, meperidine, or buprenorphine? Which one is it, guys? Which one is it? Fentanyl, hell no. Pentazocine, no. Buprenorphine, that's a no. So meperidine, yes, meperidine is going to be the correct answer. Simple, right? Meperidine, which has what? Pethidine, which has pethidine, right? Pentazocine नहीं होता श्रावणी. Chalo. Anti-epileptic drugs, carbamazepine acts as. Okay, anti-epileptic drug, carbamazepine act as calcium channel blocker, sodium channel blocker, glutamate antagonist, or both A and C. Which one is it? Which one is it, guys? Carbamazepine. कार ना चलाओ. कार नो. कार ना चलाओ. Yeah. Which one is it, guys? That is your obviously going to be your sodium channel blocker, right? Sodium channel blocker. Carbamazepine, simple, right? And if I talk about carbamazepine is a drug of choice in which kind of seizure? Which kind of seizure? Carbamazepine is a drug of choice in which kind of seizure? Yeah? Anyone? Calcium channel blocker, that's your 𝙂𝙄𝙎𝑃ℎ𝑒𝑟 to be precise. 𝙂𝙄𝙎𝑃ℎERE. Simple. T-type calcium channel blocker. T-type calcium channel blocker. It is a DOC for partial seizures. Partial seizures, right? Good issue. Very good. है ना? Partial seizure में DOC की तरह use करते हैं, right? Glutamine antagonist. That is what? That is what? Grand mal. That is what? Correct. GTCS में. Very good. Very good. Trigeminal neuralgia. Very good. है ना? चलो. Now, long acting diazepam is long acting. फोन की बैटरी लंबी होती है. Long acting benzodiazepine is generalized chronic teaser. That's right, filtered. है ना? Methoxytone, phenobarbital, midazolam, or mephobarbital. Which one is it? Anyone? Long acting benzodiazepine, methoxytone, phenobarbital, midazolam, or mephobarbital. Which one is it? Phone battery is longest. Like, so phenobarbital always, right? Phenobarbital, बच्चे. फेनोबार्बिटोन फोन की बैटरी लंबी होती है, राइट? ड्रग ऑफ चॉइस फॉर मायोक्लिनिक एपिलेप्सी. चलो नाउ टेल मी दिस वन. ड्रग ऑफ चॉइस फॉर मायोक्लिनिक एपिलेप्सी. मायोक्लोनिक, क्लोनाजिपाम. आई हैव आस्क्ड द लॉन्गेस्ट एक्टिंग, नॉट शॉर्टेस्ट एक्टिंग. इशू. चलो. डायजेपाम, मैग्नीशियम सल्फेट, वैल्प्रोइक एसिड. Which one is it? Yeah, drug of choice for myoclonic epilepsy. That is what? Valproic acid, right? Now, can anyone tell me? Valproic acid is correct answer. Now, can anyone tell me what is the teratogenic effect? What is the teratogenic effect of valproic acid? Can anyone tell me that? Can anyone tell me that? Yeah. What is the teratogenic effect of the valproic acid? Magnesium sulfate is used in pregnancy, right? Pregnancy. Correct issue. Very good. है ना? Magnesium sulfate used in pregnancy eclampsia, right? Pregnancy eclampsia. Very good. है ना? Valproic acid, spina bifida. Very good. Very good. You're doing good today. Spina bifida, right? Very good. Cleft palate नहीं. Cleft palate 𝘂𝙎𝙎. Cleft palate is for methotrexate as well as phenytoin. Neural tube defects, that's right. Neural tube defects तुम्हारा कार्बamazepine के साथ भी होता है ना? Neural tube defects is associated with carbamazepine as well. Understood? Chalo. Now, so this table is very much important. Generalized tonic-clonic, grand mal, epilepsy, atonic, myoclonic. These for valproate, right? Partial seizure, carbamazepine. Status epilepticus, IV lorazepam, as well as diazepam can also be taken at that time. Febrile seizure, 110% rectal. Seizure for eclampsia, magnesium sulfate. Infantile spasm, vigabatrin, myoclonic, that's your valproic. This is very much important. You have to remember this one because direct question they do ask. Okay, Shravani, you should also look at this one because this table is very much important. They do ask question in drug inspector examination as well as your pharmacist examination as well. Okay. Chalo. Antagonist of benzodiazepine is Chalo, simple. Benzodiazepine poisoning to be precise. Right? Antagonist of benzodiazepine poisoning. Picrotoxin, atropine, naloxone or flumazenil. Which one is it? Yeah. Okay. Last में phenobarbital भी था, right तो था ना? Yes, I have that doubt to filter. एक बार check कर लीजिए सर last वाला. Okay. We'll look at that one. Okay, which one is it? That's your D, obviously, right? Flumazenil is having the antagonist of benzodiazepine poisoning, right? Picrotoxin is what? Picrotoxin is your non-competitive benzodiazepine, non-competitive inhibitor of the benzodiazepine site, right? Non-competitive inhibitor of benzodiazepine site. Atropine, simple, you know that. Physostigmine poisoning में we can give that, right? Physostigmine poisoning में we can give that. Naloxone Naloxone is being used in your morphine as well as your alcohol, right? Flumazenil, benzodiazepine. Now, can anyone tell me which can be used? Which drug can be used in barbiturates poisoning? Barbiturates poisoning. Barbiturates poisoning. Is there any drug which can cause opioid antagonist? That's right. Naloxone. Very good. है ना? Barbiturates poisoning में कोई drug use करते हैं अपन? Do we use any kind of the drug into the barbiturates poisoning? Yeah? Anyone? No specific drug? No drug, no drug, no drug. That's right. That's right. But suppose if barbiturate poisoning occurs somehow, then what can be done? What can be done then? No antidote for barbiturate. That's right. But what if it happens? Then what can be done? Very good issue. That's what I wanted to hear that one. That's your urine alkalinization. Simple. Very good. Urine alkalinization. Ankita, very good. Filtered. Very good. Very good. Very good. Very good. Urine alkalinization, right? Because barbiturate is what? Weakly acidic drug. Simple. So, very good. Very good. You're doing good. Issue Ankita and filtered. Very good. Chalo. Now, which of the following has major action under the mu receptor? Mu receptor, I'm asking. Endorphins, enkephalins, dynorphins, or none of the above. These are those hormones जब तुम्हें चोट लगती है और तुम्हें दर्द नहीं होता उस टाइम पे, बट तुम जब घर आते हो, when you come back home, you feel like hell of a pain, right? But when you get injured at that time, you don't feel any kind of pain. So these are your what hormones? है ना? Endogenous hormones. Endorphins, enkephalins, dynorphins. That is what? That is your A, right? Endorphin is going to act on your mu receptor. Correct? Chalo. Very good. Now, which of the following is a melatonin receptor agonist? Melatonin receptor agonist. Pehle tell me, melatonin is released from which gland? Melatonin is released from the which gland? B on delta, C at kappa. Very good. Issue. Shravani 31AA. 31AA? क्या 31AA? 31 amino acids. Hmm? Yeah. So that is what? Rameltion, right? Rameltion is going to be the correct one, and Rameltion की tablets भी आती हैं market में. We do have the tablets of Rameltion, right? है ना? Gland is your pineal, right? Gland is your pineal, and that is what released at night, है ना? When we take some dudh, or you can say when we take some milk at the night, है ना? And that enhances the secretion of melatonin through the pineal gland, and it maintains the circadian rhythm. Maintains the circadian rhythm, the 24-hour cycle circadian rhythm. Okay, zolpidem is your Z drugs. Z drugs of benzodiazepine. Z drugs of benzodiazepine, because benzodiazepine do cause the you can say hangover kind of a thing, right? Because they do cause hangover. So zolpidem are those drugs which doesn't cause any kind of the hangover, right? So that's why. What if someone doesn't drink milk? There are lots of people who don't drink the milk because of the lactose intolerance. You know, they don't able to digest the milk. That's why. But still, melatonin keeps releasing through the gland. है ना? Milk is not only the one factor which releases the melatonin. Exercises, meditation, yoga, running, all the other things as well are responsible for melatonin secretion. All right. Good evening, Ishwarya Arya. Chalo. Now, overdose of pentazocine is treated by now. Overdose of pentazocine is treated by naloxone, nalbuphine, nalorphine, or butarphenol. Butarphenol. Naloxone, nalbuphine, nalorphine, or butorphanol. Which one is it, guys? Which one is it? Pentazocine overdose. Simple. Yeah. Come on, come on, come on. Come on, come on. Turn the radio on this Friday night. I won't be alone. वो Friday night है क्या आज? नहीं Friday night नहीं है आज Saturday night है. Okay. That is what the naloxone is, right? Naloxone can be used in your pentazocine overdose, right? चलो simple है ना? That is what pentazocine is your partial opioid agonist. Naloxone is a pure opioid antagonist. Understood? चलो. Parkinson disease is characterized by the deficiency of which type of neurotransmitter? चलो भाई simple है. Simple. Parkinsonism में what happens? Dopamine level decreases and acetylcholine level increases. Right? Sia, right? Cheap thrills. Correct. Issue Benival. Sia. So, what happens? Deficiency they have asked, right? The deficiency, acetylcholine, dopamine, noradrenaline. Which one is it? That's your dopamine, right? My favorite song, Kya Baat Hai, Filtered, very good. My favorite song of is like Walking Down 29th apart. Let it be, guys. Chalo. So, dopamine, right? Chalo. Okay. Now, bromocriptine is agonist on. Bromocriptine is an agonist on. That's a dopamine analog, right? Dopamine analog. So it is agonist on 5-HT2A receptors, D3 receptors, or D2 receptors, or M1 receptors. Which one is it? Happier. Can't choose one. Nah, there is one. There is a one. When I get thoda sa low feeling, so I used to hear a song named as Happier by Ed Sheeran. That is one of my favorite songs. Okay, it keeps me feel alive. Okay, that's your dopamine receptor, right? Shallow, very good. D2 receptors. Okay. Which of the following is drug is aldehyde dehydrogenase inhibitor? Chalo, bachcha log. Aldehyde dehydrogenase inhibitor. Disulfiram, ethanol, acetic acid, or fomepizole. Which one is it? Which one is it, guys? Which one is it? Hana? Aldehyde dehydrogenase is useful for what? It is useful for what? It is useful for what? Formaldehyde. Formaldehyde to formic acid, right? Formaldehyde to formic acid. Simple. It's so good. Yes. Chalo. Aldehyde dehydrogenase is responsible for the conversion of formaldehyde into formic acid, right? So disulfiram is what? Acting onto this side, correct? Ethanol can be given if there is a methanol poisoning. If methanol poisoning happens, ethanol can still be given at that time, just because ethanol having higher metabolic rate as compared to the methanol, right? Acetic acid doesn't have any correlation. Fomepizole, yeah, fomepizole is a drug of choice for methanol poisoning, for methanol poisoning, right? And there are also very much kind of the drug which causes reactions like disulfiram like reactions, right? Chlorpropamide, metronidazole, chlorpromazine, right? So they do cause the disulfiram like actions, right? Simple. Retinal damage. Retinal damage? ECDs. Share Utja Zara is best song for mine when I feel emotional. Yeah, it's good. है ना कि सबका अलग अलग होता है हिमांशु. चलो. Now, most effective drug for slopping. Generalized tonic-clonic status epilepticus in adults is. चलो. Nitrofuran doing? Greasevolvin? कहाँ क्या बोल रहे हो? अच्छा वो that was disulfiram like reactions. Yeah. Correct. Most effective drug for stopping generalized tonic-clonic stopping है वो stopping. Generalized tonic-clonic status epilepticus. Status epilepticus का नाम सुनते ही सीधा diazepam, right? It's going to be the correct answer. Okay, this one is important as I told you before also. Partial seizure, carbamazepine, right? Generalized tonic-clonic, sodium valproate, lamotrigine, as well as the carbamazepine, right? Absent seizure, sodium valproate, ethosuximide, right? Myoclonic, sodium valproate. Atonic, sodium valproate. Correct? That is going to be the thing. Status epilepticus में, to be precise, lorazepam, IV lorazepam is preferred, but since diazepam is written over there, so diazepam can also be considered for that, right? Chalo. Drug used in the treatment for bipolar disorder. Bipolar disorder, kabhi din, kabhi chhaon, है ना? तो that's symptoms like kabhi sadness, kabhi hyperactivity. That is what your bipolar disorder is, है ना? तो which drug is being useful for that? Nitrofurantoin comes under the Benoda. Comes under Benoda, which is used in reducing alcohol. क्या भाई क्या बोल रहे हो? Filtered, है ना? So that is what lithium it is, right? Lithium, simple, है ना? Lithium can cause lithium-induced diabetes insipidus. Lithium-induced diabetes insipidus, and what happens in diabetes insipidus? Your ADH level, है ना? ADH level reduce down, right? So can anyone tell me which drug is becomes the drug of choice for lithium induced diabetes insipidus? Yeah, anyone? Can anyone tell me which drug can be used into the lithium induced diabetes insipidus as a drug of choice? That's right, very good. That is what? Amylo. Right. Amylo, right, is useful as a lithium induced diabetes insipidus. And lithium is very much nephrotoxic, right? Nephrogenic. Very good, Radhakrishnan. Very good, nephrogenic. Yeah. Chalo, Rajnikant. Rajnikant is what? Rajnikant is at valproate. Okay. Chalo. Which drug increases the noradrenaline release by blocking the presynaptic alpha 2 receptors? Okay. Which drug increases the noradrenaline release by blocking the alpha 2 receptor? Alpha 2 receptor is mediated by which GPCR? Is mediated by which GPCR, guys? Anyone? Hmm? Which drug increases the noradrenaline release by blocking presynaptic alpha 2 receptor? GPCR or what? Nephrogenic DI, desmopressin. Correct. That's your GI mediated, right? GI mediated response, right? So GI mediated. GI is responsible as a autoreceptor, right? Autoreceptor, and you know that adrenaline acts on all adrenergic receptors. All adrenergic receptors, right? So alpha 2 receptor is already the release of down regulating the release of the noradrenaline. Simple. So that is what mianserin. Mianserin is going to be the correct answer. Okay. Alpha 2 receptor. Simple. Chalo. Diazepam is what? Diazepam is slow acting general anesthetic agent inducing acting general anesthetic. Slow acting local anesthetic or local anesthetics. भाई ये तो हो ही नहीं सकते. Local anesthetic is nothing over here. Slow acting general anesthetic agent inducing acting general anesthetic agent. Anyone? Sir, is nitrofurantoin have disulfiram like reaction? Hate T. नहीं. I don't think so. Nitrofurantoin it do have. CGMP. Maybe it may be. But since I'm not being able to recall that, I don't think so. Chalo, fine. That is what? It's A. It's not B, Shravani. It's slow acting general anesthetic agent. General anesthetic inducing are those which are given parenteral, right? चलो. ये CGMP के अकॉर्डिंग नहीं आएगा. करेक्ट. चलो. चलो हो सकता है, हो सकता है, हो सकता है, हो सकता है, हो सकता है. N. Sorry, Pluto can't go to Mars. तो N, right? Yes. Maybe. हो भी सकता है भाई. बहुत सारी ड्रग्स हैं जो एक्ट करती हैं, है ना? तो आई कांट रिमेम्बर ऑल ऑफ द ड्रग्स. चलो. Drug that inhibits the peripheral conversion of L-dopa by inhibition of the dopa decarboxylase. Chalo simple. Methyl dopa, carbidopa, reserpine, 6-hydroxydopamine. Which one is it? Which one is it, guys? Which one is it? Methyl dopa, carbidopa, reserpine, 6-hydroxydopamine. Yeah, that is what carbidopa is, right? Carbidopa as well as benserazide, benserazide, benserazide. है ना? These are what? Manupriya KT. अच्छा. Ranker's batch Manupriya, right? Maybe. Maybe you are from Ranker's batch Manupriya. हाँ, Ranker's batch Manupriya. Okay, carbidopa, benserazide. These are your dopa decarboxylase inhibitors. Simple. Methyl dopa is DOC for hypertension in pregnancy. Simple. Hypertension in pregnancy. It produces an metabolite known to be as alpha methyl norepinephrine, and that is what known to be as the false neurotransmitter. It is known to be as your false neurotransmitter. Reserpine, again, that is what your antihypertensive. 6-hydroxydopamine. Chalo, simple, right? Bicaquilin, okay, now simple. That is also simple. Bicaquilin, antagonist of GABA A receptor, agonist of GABA A receptor, agonist of nicotinic receptor, agonist of NMDA receptors. Which one is it? Simple. सर ये S10 कौन है? What's your real name? S10? सचिन के फैन लग रहे हो, लग रहा है सचिन तेंदुलकर के फैन लग रहे हो. You seems to be a fan of Sachin Tendulkar. That is what antagonist of GABA A receptor bicaquilin. Very good, very good, very good, very good, very good. Which of the following barbiturates is ultra fasting acting? HMT. Alprazolam, methohexital, phenobarbital, or zolpidem. Which one is it? Yeah. Which of the following barbiturate is ultra fast acting? Alprazolam. What's your real name? S10. Alprazolam, methohexital, phenobarbital, or zolpidem. Which one is it? That is what? Simple. Methohexital HMT, right? Chalo. In 𝘂𝙎𝙎𝙎𝙎 syndrome, which drug is used? Tourette syndrome. Halothane? Nah, it's not elastic. Haloperidol? Yes. Haloperidol is being used for the 𝘂𝙎𝙎𝙎 syndrome. Correct? Dopamine level यहाँ भी got increased. Dopamine level also increased over here. That's why haloperidol is being used over there. Okay. Chalo. Schizophrenia, Huntington, Tington, right? Chalo. Lipophilic GABA derivative that crosses the triple B and enhances the GABA release. Okay. Lipophilic GABA derivative that crosses the triple B and enhances GABA release. Gabapentin, pregabalin, levetiracetam, or zonisamide. Which one is it, guys? Gabapentin, pregabalin, levetiracetam, or zonisamide. IG also in, I guess, also in Huntington नहीं, Huntington है वो. Huntington है. That's what we said, right? That's your gabapentin issue. That's your gabapentin. Gabapentin is your lipophilic GABA derivative. Does not act as a GABA A receptor, but enhances the GABA releases. Crosses the GABA and enhances the GABA releases. Okay? Chalo. A is it? It is. Okay, now drug acting as a having 5-HT1A receptor. We have talked about it. Agonistic activity. Buspirone, ondansetron, cyproheptadine, or clozapine. Which one is it, guys? Neuralgia, maybe they have been used. Right? Chalo. Buspirone, obviously, right? Buspirone is going to be your 5-HT1A receptor. Ondansetron, 5-HT3 receptor antagonist. Cyproheptadine, H1 antihistaminic, and 5-HT2 antagonist, right? And cyproheptadine is useful for increasing the hunger in children. Clozapine, that's your antipsychotic, atypical antipsychotic, but it still have 5-HT2A2C, 2A2C antagonistic activity. Apart from clozapine, risperidone, which is also a atypical antipsychotic. It is also having 5-HT2A2C antagonist activity. Simple. Chalo. That was simple issue. Simple. 5-HT1A receptor agonistic, to be precise, partial agonistic, and that's why it has been used in your anti-anxiety drug. Simple. Chalo. Now, side effects of TCA's drugs are the follows. Okay. Tricyclic antidepressants, weight gain, hypertension, CNS stimulation, or hypoglycemia. Tricyclic antidepressant causes maximum EPS in atypical. Correct issue. Very good. Very good. Risperidone can cause maximum EPS in atypical. Very good. Chalo. This one. TCAs increasing the weight gain. Right? They increase the weight gain. Simple. Hana? And can you tell me which anti-diabetic drug is useful in fatty people? Hmm. Do you know most? Yeah, most. Metformin has been used in your obese people. Sulfonylureas are useful for your thin people, right? So, sulfonylureas may cause the weight gain, whereas metformin used to reduce down the weight, right? Chalo. Okay. Haloperidol is what? Haloperidol, strong antipsychotic and weak sedative. Strong antipsychotic and strong sedative. Weak antipsychotic, sedative, filtered. Very good, filtered. है weak antipsychotic and weak sedative. Which one is it? Which one is it? Simple. Simple, guys, simple. Strong antipsychotic and weak sedative. Strong antipsychotic and strong sedative. Weak antipsychotic and strong sedative. Weak antipsychotic and weak sedative. Which one is it? Haloperidol is definitely having strong antipsychotic. That's why only they cause the EPS syndrome, right? That's why they cause EPS syndrome, and these are weak sedative, obviously, right? A. Okay. Chalo. Levodopa is essential in Parkinsonism treatment because it can cross biological membrane. क्या बात है? Cannot cross biological membrane. Can cross blood-brain barrier or cannot cross the blood-brain barrier. Which one is it? Chalo. Anyone? Simple. It can cross the blood-brain barrier. Levodopa plus carbidopa is been given, right? Carbidopa is been given, right? Chal. Okay. Which the following is related to hallucinogens? Oh, nashedi log. Hallucinogens, morphine, lysergic acid derivatives, cocaine or opium. Hmm. Hallucinogens किससे नशे होते हैं? नशे सबसे होते हैं, but related to hallucinogens. That's what I'm asking. नशे तो सबसे होते हैं. एक से बढ़कर एक नशेड़ी है. नशेड़ी ड्रग है यहाँ पे. Don't take it to yourself. Now that is what? Lysergic acid derivative, right? Now, can anyone tell me lysergic acid derivative is related to which alkaloid? Which alkaloid? Huh? Lysergic acid derivative are related to which alkaloid? Lysergic acid derivative. Lysergic acid derivative. It is in cognosy. Which alkaloid, guys? That is your 𝙈𝙁. Very good filtered. Shravani, very good. Good going. Yeah, chalo. Lysergic acid derivatives. These are your hallucinogens. Indole alkylamines, lysergic acid derivative. Yes, chalo. Alcohol reduced to aldehyde in presence of. Alcohol reduced to aldehyde in presence of alcohol reductase, aldehyde reductase, aldehyde dehydrogenase, or alcohol dehydrogenase. Which one is it, guys? Sand Antony fire. Very good, Shravani. Good going. Very good. Hmm. Alcohol reduced to aldehyde in presence of. Issue says C. Shravani says C. अरे बच्चे अभी तो we have done कि aldehyde dehydrogenase is responsible for alcohol to aldehyde, right? But there is something aldehyde to acid as well, right? Acid as well, right? Hmm? Aldehyde dehydrogenase. That is what, right? Correct? C is going to be the correct thing. Answer is given alcohol dehydrogenase. ये कैसे हो गया? Alcohol dehydrogenase कैसे हो गया? No. That's wrong. That's C always. Right? Alcohol dehydrogenase is responsible for the ethanol to acetaldehyde, methanol to formaldehyde. That is what the alcohol dehydrogenase works, right? But your acetaldehyde conversion into the acetic acid, formaldehyde converting into the formic acid, aldehyde dehydrogenase takes place, right? And which drug acts onto the aldehyde dehydrogenase? Which drug acts onto the alcohol dehydrogenase and aldehyde dehydrogenase? Aldehyde dehydrogenase, that's your disulfiram. Whereas this one, it's your fomepizole. Simple. Fomepizole. Yeah? Sure. Anti-epileptic drugs used in pregnancy. Okay. Anti-epileptic drug used in pregnancy. Lamotrigine, phenytoin, valproic acid, or all of the above. Which one is it? Yeah? Anti-epileptic drug used in pregnancy. Lamotrigine. That's right. Yo. Because you know that phenytoin can be used to cause the cleft palate, right? Cleft palate, है ना? अगर किसी ने D आंसर दिया, if anyone gives the D answer, I will block you from the session. I will block you from the session if anyone gives the answer D. Right? Phenytoin is responsible for cleft palate. Valproic acid, spina bifida. Right? Spina bifida as well as the neural tube defects. Lamotrigine doesn't have any kind of the effects, teratogenic effect. So, lamotrigine can be given to that, right? Chalo. Okay. Phenothiazine antipsychotic. Pheno to theek, but what about others? Can anyone tell me? Phenothiazine antipsychotic is thioridazine, trifluperidol, flupenthixol, or zoltiapine. Which one is it? Jute pen. Jute pen. Jotia pen. Okay, which one is it, guys? Thioridazine, trifluperidol. Nah, ये तो नहीं है. That is what the butyrophenone, right? Flupenthixol, thioxanthines है ये. So thioridazone, obviously, right? Thioridazine to be precise. And thioridazine having, having least EPS, if you remember. That is what? Least EPS. Correct? Least EPS. Extrapyramidal syndrome. Least is concerned with the thioridazone. Correct? Chalo. Drug of choice for cheese reaction. What is cheese reaction? What is cheese reaction, guys? Cheese reaction is also known to be as the hypertensive crisis. Hypertensive crisis. How hypertensive crisis takes place? Just because of you have taken just because you have taken Mao 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 inhibitors, right? Just because you have taken Mao inhibitors. अरे ठीक है, yes, I know phentolamine is correct answer. Now listen to me, what is C's reaction ना, है ना? It seems like कि वहां वाला सेशन खत्म हो गया, right? आशीष चौधरी अवस्थी अवस्थी जी, आशीष चौधरी जी, it seems to be like कि वहां वाला सेशन खत्म हो गया. Now you have came here, isn't so? अपराजिता, है ना? The food which contains the tyramine, food which contains tyramine, है ना? And tyramine is responsible for the synthesis of adrenaline, right? And if you inhibit the Mao, which is responsible for the metabolism of adrenaline, which is responsible for the metabolism of adrenaline, right? So metabolism will not take place, adrenaline secretion will enhance, and you know that adrenaline synthesis will be take place, so hypertensive crisis will be taking place after that, right? So hypertensive crisis will be happening after that. So phentolamine is going to be the correct answer. Prazosin is your alpha 1 antagonist, है ना? ये ऐसे बच्चे हैं जहाँ पे स्कूल खत्म होने के बाद ट्यूशन पढ़ने जाते हैं. वहां स्कूल चल रहा था, यहाँ ट्यूशन पढ़ने आए हैं. प्राजिता, यस. Phenoxybenzamine is useful in pheochromocytoma, right? That is what the kidney tumor, है ना? adrenal gland का tumor है. Alpha 1 antagonist prazosin. Floppy iris syndrome, if you remember, floppy iris syndrome, right? Floppy iris syndrome is associated with the prazosin used if they used to be taken with in cataract condition में, if they have been used, right? That is what the prazosin. वहां पे explanation नहीं मिला तुम्हें अपराजिता? हाँ? Didn't you got any kind of the explanation over there, है ना? गौतम सर है भाई वहां पे. वो एक्सप्लेन नहीं करेंगे तुम्हें तो क्या कौन करेगा, राइट? चलो, phenoxybenzamine, right? Now, which drugs act under the alpha subunit of GABA? Okay, alpha subunit of GABA, simple. Alpha subunit of GABA, benzodiazepine, barbiturates, haloperidol, or TCAs. Yeah, एक्सप्लेनेशन सुनने आए हैं, वहां पे एक्सप्लेनेशन नहीं मिला. आशीष चौधरी जी, हरियाणवी जी हैं. दोबारा से सर रिवाइज हो जाता है, क्या बात है, बड़े पढ़ाकू बच्चे हो तुम लोग. अपराजिता, है ना? दैट इज व्हाट बेंजोडाइजेपिन इज, राइट? चलो, सिंपल. Okay, all of the following are anti-epileptic drug which act via blockade of sodium channel except, okay, sodium channel except phenytoin, carbamazepine, topiramate और vigabatrin, जो नहीं करते हैं काम. hmm. Onto the sodium channel. Phenytoin, yes they do. Carbamazepine, yes they do. Topiramate, yes they do. Vigabatrin, transaminase एंजाइम. आपको देखने आए, इतनी शक्ल अच्छी तो नहीं है मेरी. शैडो स्नाइपर्स, दक 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 हैं, गोलियां चला रहे हो तुम तो, है ना? गोली मत चलाओ यार यहाँ पे. नहीं, इतनी अच्छी शक्ल तो नहीं है मेरी. Okay guys, so vigabatrin, that is your transaminase enzyme, right? Okay, now, yes, correct आशीष, है ना? बारबिचुरेट बीटा सबयूनिट, सर बारबिच भी तो अल्फा पे ही बाइंड करती नहीं, वो बीटा पे बाइंड करती है. ये बीटा गामा के थोड़ा सा बीच में काम करती है वो, ठीक है? परगोलाइड एंड बाइपेरिडिल बोथ वर्क एज एसीएच agonist, डोपामीन agonist, ACH antagonist और डोपामीन antagonist. Which one is it? सर हिंदी में कंप्लीट हो गया. कॉमन सर, फास्ट एंड फ्यूरियस. विन डीजल नहीं हूं मैं जो फास्ट एंड फ्यूरियस यहाँ पे तुम्हारे लिए मैं वो बनाऊंगा, है ना? नॉट अ विन डीजल, नॉट इवन अ रॉक द ड्वेन जॉनसन who will be casting in the Fast and Furious kind of the series, Hollywood series, right? Pergolide and pyridine. Anyone? Anyone? You are saying dopamine agonist. Okay, bachcha log says dopamine agonist. That is your dopamine agonist, right? Correct? Very good. Very good. Very good. But you are kind-hearted, Master G. कैसे पता तुम्हें कैसे पता तुम्हें कि मैं kind-hearted हूँ? Every teacher is a kind-hearted, no? चलो. Anti-convergent drug acting via inhibition of T-gated calcium channel. T-gated calcium channel. Simple है. T इत्थे लाओ. T इत्थे. है ना? इत्थे लाओ. T इत्थे लाओ. That's your ethosuximide. Ethosuximide, right? So ethosuximide, ये लो. इत्थे T लाओ. है ना? है ना? Okay. काके C. That's your काके. T इत्थे लाओ. T इत्थे लाओ. That is what the thing is, right? Okay. Now, all of the following antileptic drugs acts via sodium channel except, okay, vigabatrin, phenytoin. अरे यार, ये तो same question हो गया. चलो simple. Again, that is your vigabatrin, but they have just flip off the options, right? Vigabatrin, phenytoin, valproate, or lamotrigine, right? Okay, so vigabatrin, obviously, correct? Chalo. Which of these is used as a pre-anesthetic agent? Pre-anesthetic agent: aspirin, atropine, amlodipine, or astaxanthin. Okay, simple. Aspirin, non-selective COX inhibitor, non-selective COX inhibitor, right? Atropine, yes. Atropine is what? The anti-secretory, है ना? Anticholinergic, right? Amlodipine, CCB, no. Ataxanthin, मुझे नहीं पता, to be precise. Okay, so CCB is going to be the amlodipine, right? So atropine is being useful for that, correct? Atropine, correct? Chalo. Sertraline belongs to the compounds. Okay, sertraline, fluoxetine, sertraline. MAO inhibitors, serotonin reuptake inhibitor, norepinephrine reuptake inhibitor, none of these. Which one is it? Which one is it, guys? Yeah? That is what? Sertraline. Oh, yes, atropine. Yes, atropine. That is your serotonin reuptake inhibitor, SSRI. Correct? Chalo. Okay. Following endogenous opioid is a pentapeptide. Okay, pentapeptide, guys. Enkephalin, dynorphin, endorphin, or dynorphin B. Which one is it? Pentapeptide. That is your enkephalin. Okay. So, which of the following antidepressant is a selective serotonin reuptake inhibitor? Okay. Again, same question. See, NIPER JEE 2021, they have asked. So, you have to do CNS in a very decent manner. Complete that CNS in a very decent manner. Phenelzine? No, phenelzine is what? Non-selective MAO inhibitors. Non-selective MAO inhibitor, right? Phenelzine, tranylcypromine, right? Phenelzine as well as the isocarboxazid, that's your non-selective MAO inhibitors. Desipramine, maprolidine, and fluoxetine. Fluoxetine is going to be the correct answer, right? Simple, right? Chalo, okay. Now, which of the following agent is related to tricyclic antidepressants? Tricyclic antidepressant, nefazodone, amitriptyline, fluoxetine, isocarboxazid. अभी तो बताया. Fluoxetine is your SSRI, right? Isocarboxazid is again your non-selective MAO inhibitors, nefazodone, amitriptyline. Amitriptyline is going to be the correct answer, right? Emi, है ना? Doxydothiclomi. Doxydothiclomi, right? Chalo. TCA, which is predominantly noradrenaline and 5-HT reuptake inhibitor is, okay, tricyclic antidepressant, which is predominantly noradrenaline and 5-HT reuptake inhibitor is, which one is it? Clomi, correct. Filtered, okay. So that is what? Imipramine, nortriptyline, amoxicillin, or trazodone. Which one is it? That is your imipramine, guys. Okay. All right. So this is all about the session of today's CNS pharmacology for you guys. I hope it must be thoda sa beneficial for you. Thoda sa you got revision over there, and I hope you have liked the session. If you do like the session, do like the video over there. Do like the video wala symbol, and thank you so much. Any confusion, any doubt? Any confusion, any doubt? आज जल्दी एंड हो गया. हाँ, आज जल्दी एंड हो गया. How was the session, guys? How was the session? Full satisfied? Satisfied? Give me hearts. Give me hearts if you're satisfied. Explanation अच्छा है सर आपका. Thank you, अवस्थी जी. Thank you. वीडियो वाला लाइक. चलो ठीक है. सेशन लाइक कर दी सर. ओके, थैंक यू प्राजिता. कमेंट भी कर देना वहां पे जाके, है ना. सेशन एंड होने के बाद में कमेंट कर देना, या फिर कल सुबह आकर के एंड कल सुबह आकर के दोबारा से कल सुबह दोबारा से आकर के एंड कर वो कमेंट कर देना. ठीक है. ओके गाइस, ठीक है. थैंक यू सो मच, एंड विल बी लाइव अगेन मे बी डे आफ्टर टुमारो. हाँ, डे आफ्टर टुमारो विल बी लाइव अगेन. ओके, चलो. नॉट टुमारो बट डे आफ्टर टुमारो. एक्सप्लेनेशन अच्छा करते हो तो तुम जाते तो तुम लोग वहां पे हिंदी वाले में हो, यहाँ तो आते नहीं हो. है ना. यहाँ तो वैसे ही 10-15 लोग रहते हैं. वहां पे तो 200 300 250. यहाँ पे तो हम 10-15 लोगों में ही रहते हैं, है ना. We do have only 10 to 15 peoples only. I've never seen around 50 peoples, even 50 peoples over here. I never seen that. Just we got ki everybody go there and join there. Chalo. Okay, no worries, no complaints, no demands, and that's what we have for you, है ना. That's what we have for you, and thank you so much for your patience. Thank you so much for your presence over here as well, and that's what makes my heart cherishful. And okay, guys, bye bye. Good night. Take care of yourself. And we are family, right? We are family. Yeah, there are issues, no issues, no issues, no issues. We are family. Correct. Okay, guys. Chalo. Tada, bye bye. Good night. And all of you, do come at the felicitation program. Okay. We'll be seeing you guys. हाँ, मैंने भी खाना बनाना है. मैंने भी खाना है अवस्थी जी. Okay. है ना. We'll see you into the felicitation program. Do come over there. Okay. Good night. Khamosh. Filtered. Himanshu. Bye bye, guys. Champions. Bye bye. Take care of yourself. We'll be right back.